and welcome to And So Much More. I am here with Dr. Tuladhar, who is visiting from Centra Nationwide, CMG Nationwide, which is one of our primary care facilities. If you go into Nationwide, there's so many things in there. There's HealthWorks, there's bariatrics, there's a lot going on in there. But that is where I go to visit my primary care, and it's a huge facility, so I know a lot of people in our community get to visit. But we wanted to talk about what does it look like to sustain that relationship and to really allow that voice of wisdom from the healthcare providers in our life throughout all the transitions of our life. Because, a lot of people will keep their primary care provider throughout their whole life, which is pretty incredible. But before we jump into that, I'm getting ahead of myself. Why don't you tell us a little bit about yourself? What brought you to Centra and what you do?
Sure. So I work as a primary care doctor at CMG Nationwide. I've been with Centra almost on and off for like 10 years now. So I did my residency here.
Oh, okay.
I was with the hospitalist group for a few years, did urgent care shortly in Northern Virginia, and then came back. And I've been with CMG now, this stint around 3 years, a little over 3 years.
Okay.
I'm also the vice chair of the CMG board on the quality committee, and really like to be really involved in the community.
I love that.
I mean, since I've done urgent care, hospice, and primary care is my absolute favorite. So it's been really great, and I've really loved it so far.
I love hearing that. So you do a lot. Like, there's not just one and done. You're kind of involved, hands in a lot of different places. You mentioned community work. What types of stuff do you do in the community?
So me and my husband, we volunteered at I think it was the local soup kitchen.
Yeah.
So that was really great. And then through the residency program, we did a lot of like community service activities.
Yes.
And then I think Centra also does a community health where we bring people in the community that are involved, like, teachers and social workers, and having, I think it's called a community needs assessments. I was involved in that a few years ago.
Yeah.
So just kind of being involved in whatever capacity.
Yes, kind of listening for the need and leaning into it. Yeah,
for sure.
Very cool.
Yeah.
So many different topics when you think about aging and transitions throughout your life. And so I guess to start just at the beginning, what age do you typically see? Like, what's the youngest age that you see?
So our practice right now is a little bit different because even though I'm trained in family medicine, we see internal medicine. So I see primarily above 18.
Okay.
Before that in residency, I was seeing peds. So really depends on what parents prefer. Some parents do like to go to their family doctor that sees kind of the whole family.
Yeah.
Some people like to see a pediatrician. Typically with pediatrics, that first year, you're going to be seeing the doctor like a lot, probably every month, eventually 3 to 6 months. And then after they hit a year and the vaccines get a little bit less, it gets a little bit less. I think with the pediatric portion, I think vaccines kind of are a controversial issue for some, but that's probably the main criteria. But having a 3.5-year-old myself, I love my visit with a pediatrician or just kind of a healthcare provider. The things that I ask as a parent, the things that I'd like to know, just developmentally, are we kind of hitting all the milestones?
Yeah.
And just honestly, for reassurance, I think being new parents is so hard.
It is.
And you have no idea what to do with this little human that you've just brought into the world.
So true.
But I think having just another adult tell you that you are, doing a good job.
Everything's
is really
okay.
Exactly.
There is a lot of peace that comes in those visits. That's funny.
And so I think, and then after 18, 18 to 36, most of the time it's things like STD screening or maybe evaluation for things like ADHD or, depression.
Yeah.
And then again, probably after 40 is when a lot of the guidelines kind of recommend other routine preventative measures.
So for the new adult, your 18-year-old, and you are transitioning from your primary care doctor. I went to the same pediatric doctor, my whole childhood, and I can close my eyes and see the waiting room. But I also remember being slightly older and sitting in the same waiting room with like the toy area and feeling a little out of place. And so I was really excited to like have a physician that was my primary care doctor that I could have conversations with or without my parents there. So what do those visits look like? Like, are there things that they should share with you? Kind of what is keeping that honesty and that complete transparency that you should have?
Sure. So I think as a new young adult, I think going to a doctor is very overwhelming, right? Because it's the first time you're not in a pediatrician's office. And I think if we can find common ground, and that's true with all patients of all ages, finding a way to connect, so whether asking about what they like to, I mean, I think I like to start off by asking patients about what they like to do for fun or, where was the latest place they went on vacation. And so finding common ground, because the only way you're going to have a good relationship with your provider is finding things in common. And as human beings, we all have things in common with each other.
Yeah,
right?
it's so true. It's so true. And we talk in previous podcasts about it's okay to find the provider that is the best fit for you.
Exactly.
Like, it's not like you call, you get an appointment, and you're assigned, and that is it for the rest of your life.
Yeah, I tell patients all the time, it's like dating. Sometimes you just have to go on a couple to find the right one for you.
It's true. It's true. And so I think a message I want to send to those 18, 19, 20-year-olds who are starting with a new provider, advocate for yourself, ask for the questions, make sure that it's a good fit. And I love what you said, you must be a really good fit for a lot of people because you're so personal and you make it about more than just, there's nothing worse than going into an appointment and it's just sterile. And it's let me do the things I have to do, goodbye. And I know, maybe somebody wants that, but I would and I would assume for most, you want an environment where you can have even hard conversations. And it makes it easier when there's somewhat of a relationship in place.
Oh, certainly. And other things I think for young adults definitely to cover is nutrition. So I think just as a country, we are just lacking in general in nutrition.
It's so true.
Covering, how much protein should they be eating? How much water should they be drinking? Bowel movements. Sleep, bowel movements or sleep are really good indicators of how a human being is doing in all age groups. Definitely now with social media, there's a lot more anxiety and depression we see in patients. So just checking in with them and seeing, what is their social media use like? Do they have a sense of community? Are they being bullied? Are they in need of, let's say, birth control? Are they wanting birth control, or are they not, refraining from sexual, wherever they stand? A lot of the younger adults tend to come with their parents. So one thing I like to do is maybe set the parent out in the lobby just for a few minutes. And that's kind of when I check in about any type of sexual or physical abuse, any type of bullying, and just making sure that if there's anything that they want to discuss with me confidentially, outside of just, being in their parent role, and just work, how things are going at work, and just having them feel like I'm a confidant, I'm here to listen to them, and I'm really there to support their journey.
Yes. I love that you're checking in about any kind of abuse, because I feel like I didn't know that those conversations were happening with primary care doctors. And it's so reassuring because I feel like sometimes you just can't say certain things to your parents, whether that's because you have such a good relationship and you don't want to ruin that with a really hard experience, or maybe that parent is involved in what's happening. And so that's really cool that you guys provide a safe place for that. You mentioned bowel movements and sleep being such a big indicator really throughout your entire adult life. And so as you're seeing a need develop in someone's life for them to go to a specialist, like, hey, we should lean into this. This is an indicator of something. Don't want to call it anything, but what are some of those indicators that you see? I know it can be, specialization specific, but what are some things we should be like, this feels off, I need to get some help?
So in general, whenever I'm treating any patient of whatever age, always the goal is mind, body, spirit alignment, right? So what ends up happening is I love the specialist route, and it's appropriate in certain situations, but there's usually something else that's kind of driving the situation, right? So if you have a young person that's very, very anxious, let's say they're about to get married or start a new job, chances are that they're not going to be able to sleep and they're going to have issues in their bowel movement. You know, can you send them for $1 million GI workup? Yes, but you know what? Chances are all of that's going to be negative, and we're going to be in the same room having the same conversation. So I think it's better off having those difficult conversations of what do you feel like in your life is out of alignment. And that's exactly what I say. In terms of your mind, in terms of your body, and in terms of spirit, which I use loosely in terms of your purpose of life, right? Like what is kind of driving you.
Fulfillment.
I think that we all as human beings, if we can address those three things every day, that brings balance. And oftentimes, whatever the symptom is, whether it's a vague rash that's all over the body or it's something GI, because disease is basically dis-ease, right? It's something that is out of balance. So yes, is there a role for a specialist? Certainly. But I think as primary care doctors, we all could do a better job to figure out, well, what is the real issue, and are we really doing everything within our scope to address it?
I love that so much. And I think I'm specifically thinking about my children, but I think a mom, we tend to think about our children's health before we think of our own. But even in my own life, I think to set somebody on a course of learning how to read their own body by asking those questions daily. Because I think it's hard sometimes to know even how you are feeling when you're not used to paying attention to yourself in that way. That is really good. I love that. And I also think that for some of these young adults who a lot of times like Wikipedia and Googling, like that can just be the enemy, and they're coming in with this preconceived belief, like, oh my gosh, I have such and such. It meets all my symptoms. And so I think it's really important and probably very patient and peaceful for them to come into like, let's not jump there. Let's start with what could be indicative of these things. So that's a very cool approach. Do you have, so I am a woman in my 40s, and I think about the questions I'm asking now, like I'm not a young adult anymore. How do you address when women come in and they're like, what is happening to me? Hormones and perimenopause and menopause. And then even for men, like obviously I'm not a man, so I don't know. Like what questions are they asking, and are they asking the right questions? How can you encourage them to lean into their health in a different way in our 40s and our 50s where we're not quite, in an elderly stage, but like a lot's happening here.
Oh yeah. Yeah, certainly. So I think I love my female patients. Most of my patients are female, okay? I think that women are like cycles of the moon. What that means is that, yes, we have times in the month we bloom, but that also means we need rest, right? So as a society, we've forgotten to sit down, we've forgotten to take a breath, and we've just forgotten to give ourselves a moment, or even honestly, quote unquote, be stuck, I think we live in such a go society, which I think then is causing a lot of these secondary symptoms, right? Okay. So specifically for women, I think nutrition is a big part of it. So for, let's say, an average 150-pound woman, she needs at least 150 grams of protein, right? Making sure she's well hydrated, at least a gallon of water, maybe less if they have kidney disease or other issues. Making sure that they're taking supplements, unless we are building a fire in the woods and eating off the trees, we need supplements, okay? And so what supplements for women specifically, usually if they're within the childbearing age, I'm a big fan of the prenatals. If they're not in that age, just a regular multivitamin. Checking in with their gut. So I think in terms of the gut, the probiotic is a great supplement, making sure that they're regular. A lot of perimenopausal, menopausal women have issues with sleep. And so magnesium is one that I'm a big fan of. Usually I recommend magnesium glycinate, like 500 milligrams. It's just very good for hormonal support. And eating colors of the rainbow, right? So what ends up happening is when we eat things that are processed, our body gets inflamed, and inflammation causes worsening, right? So I think of age in itself as a disease, because if we optimize our health and like the mind, body, and spirit, I think we could be living till 150 or more.
Yeah.
And so I think we have this perception of age.
Yeah.
But also a lot of the society right now is really difficult to navigate because social media shows you this one perspective.
It's so true.
And so you're comparing your real life with somebody's like photo version of their life.
Yes.
And I assure you, because I have all of those patients, that it is not like that. And I try to tell people that, we all struggle with the same things and we're all fundamentally humans. But for women, I think with the cycles, as we get older, it's something we have to honor more.
Yeah, that's so true. And that's a good perspective. We totally do. I can't say we. I lean into those things that you see on social media in good ways and bad ways, because in ways where I could compare my life to someone's life and my life will never look like that. That's not my path. But also in maybe an unhealthy way, not that the first one wasn't, but where they're going through perimenopause and they're talking about things like sleep. And I'm like, wait a minute, am I sleeping well? Wait a minute, am I experiencing that?
Right.
And so I like put myself in a category that I might not be in yet. And that I think can be very misleading and very unhelpful, I think, for really any age, honestly.
Certainly. And specifically for men, I think men in general are more closed off when they talk to their healthcare provider. So I have to kind of dig a little bit deeper. I do see a lot more things like erectile dysfunction or issues with testosterone. A lot of guys are obsessed with their testosterone. Oftentimes it's not the testosterone, right?
Really?
So I feel like women are a lot more, they're more compartmentalizers. So they might have several issues, but they're kind of having their little boxes. And I think with men, they're kind of like spaghetti where everything is, you know what I mean? Everything is affecting everything. And so if there's stress or if there's something going on with their work life, it might very well affect their sex life. And so it's kind of a, sometimes we look for medical explanations for things that we do not want to face, right? And so kind of really being honest with yourself and kind of seeing. And the basics, I read this one time, it's just MedRx. So M is for meditation. Meditation is just really good for centering your mind. E is for exercise. And so functional exercise more so than like things like HIIT or severe cardio. And then D is for diet and RX is for supplements, right? So kind of making sure the basics are good. A lot of guys are concerned about their prostate. The official guidelines really no longer tell primary care doctors to kind of push the prostate screening. However, I know a lot of guys are worried about that, and with people with family history or if they're concerned about it, that's something certainly that I check. But I think that fundamentally men or, male or female, no matter what age, we're fundamentally all in the same boat, right?
Yeah.
So
well, and it's interesting that you say like it's hard to like pull some of those answers out of men, because I go into my poor primary care. I'm just like, blah, here's everything. But sometimes I have to talk the men in my life, like, please go, please. Because they do that, they've pinpointed on their own what the need is, and so I think that's really good advice. I love the acronym that you shared. That's very cool. A lot. I want to be like taking notes as you're talking. I'm gonna go back and listen to this myself and take notes. So that's as far as I've experienced, in my age. But obviously, care goes well beyond. And even what you shared, like we can live so much past what we are currently seeing, depending upon how we're caring for ourselves. So what does care look like for an older generation, and how much a part do you play in like those decisions where maybe it's time to receive like more hands-on round the clock care and then end of life care, or do you remain a part of their life in those stages?
And so I love to take care of my patients until the end as I possibly can. And that's really up to the patients. Sometimes, let's say if they're in an assisted living facility, usually the physician in the assisted living takes over. I think, so the people that are 20 or 40, what you do now is basically going to determine the type of life you're going to have when you're 80, right? And so that's kind of why we want to set up kind of the good foundation now to support us. So typically for people that are above 65, that's kind of where a lot more of the routine stuff, definitely you want to make sure you're hitting. So your colonoscopy, your mammogram, if appropriate, a prostate, to testing for prostate issues, things like that. I'm a big proponent of functional exercise. So what I mean by functional exercise is things that you need in daily life, right?
Okay.
So things that help you get dressed, things that help you pick up your granddaughter, things that help you
I
open
love
the
that.
car, right? So
Yeah.
we, as young people, are so obsessed with things like HIIT, and I'm going to run a marathon, and I'm going to climb the Mount
Yes.
Everest. But let's work on micro movements daily that actually help move our health, right?
Yeah.
So things like that. That's why I'm a big fan of Tai Chi. You know, there's a guy named Dr. Wu on YouTube. He has a great 10-minute video.
Very cool.
I
Okay.
love, you know, restorative yoga. There's a yoga by Adrienne on YouTube. She's great, you know.
Mhm.
So I'm a lot more supportive of micro restorative movements.
Yeah.
Because the whole point, again, going back to it, is the mind, body, spirit, right? So
Yes.
we're wanting our bodies to be as strong as they can,
Mhm.
but also flexible and functional, because that's what we need, right?
Yeah.
We don't need to be doing push-ups when we're 150, but we would like to get around,
Yes.
you know, like we want to get
Absolutely.
around. And so thinking of life in that terms, I think that kind of really
Yes,
helps.
I love that. And we have such an awesome community because I know at the Y specifically, there's a functional fitness class. And then for those who are within the Centra Health system, but then a lot of other places of employment will provide like that type of care through physical therapy. And we were over taking pictures of our HealthWorks facility, which is an incredible facility. It's also a nationwide. And they were showing us a lot of the areas within their gym that it's just like bend down and pick this up, bend down and pick this up, and repeating that movement. And so hearing you talk about this is kind of like putting all the pieces together for me, which I love. Because you do want to stay active, and you know people do want to live as long as they can, but living as long as you can is not the end goal. Being as healthy as you possibly can.
Exactly.
Yeah.
And the other thing is, I think protein. So as we get older, protein's always important, but I think as we get older, we lose a lot of muscle mass. And so what I find is that oftentimes a lot of these older patients are living on their own. They're maybe not really eating a lot of different foods. They're kind of limiting their options. So I kind of go through each grocery store and say, well, if you're shopping here, you know, you can kind of get these options. And this is how much 30 grams of protein looks like. And you always start with 30 grams of protein with each meal, you know. And functional exercises, like let's just get up and sit down, you know, once an hour, let's move for 5 minutes. And also mood, right? So if we're not happy, what people don't realize is our cells are not happy. And when cells are not happy, they give us cancer and disease, right?
Oof,
so everything is together. And so we have to make sure we're part of the community, right? So there's a concept called ikigai, which is a Japanese concept, which is the purpose of life, right? So they looked at these people that are centenarians in Japan, and how come Japan has so many 100-year-old people? And that's because they have a purpose. You know, they get up in the morning, they work on their garden, they go down, you know, the hill, get their water, then they drink tea, and then they take a nap. And then they have these communities called molis, which is groups of people that have been friends for, I don't know, 50, 60 years.
That's amazing.
You know, like once a week.
Yeah.
You know, like having that community.
I want
and
that.
love, you know? I mean, when I was looked at when I heard about it, I was like, this is amazing. Japan has some really cool, like, health, you know, health stuff. But just the idea of, I think the people that do the best are the people that are, you know, if church is appropriate, they're going to church. You know, they have their grandkids, once in a while. But just we can't live in an island.
Yeah,
you know,
need a
and
full...
no matter how cranky somebody is, even they need love and support and community.
Yeah, that's incredible. Yeah. You have so much wisdom to share. This is wonderful. That's kind of covering what we wanted to talk about specifically with transitions. But I mean, is there anything I haven't asked you that you feel like would be really useful, specifically as it relates to just getting to know your primary care? I mean, so much of what you shared is within a relationship with a primary care doctor and a primary care provider. And when I think about those who just won't go, you know, it's, you wouldn't, well, maybe some of you would, you wouldn't try to put something together without the instructions. Like you're not going to do that well. It's essentially someone to walk alongside you so that you can live your best life. So just as it relates to that, is there anything I didn't ask you that you would like to share?
Sure. So I think one big driving home point is happiness is an inside job, right? So I think we as a society are looking for it outside, right? So we want the next best thing. We want the bigger house, the bigger car, we want our kids to go to the better schools, all of that stuff. But I think fundamentally as humans, we need to realize that even if we lived in the biggest mansion in Malibu, we would be still taking ourselves with us, right? And so unless we are happy where we are and grow where we are, we're fundamentally not going to be happy, right? And so where that comes from is practices like meditation, yoga, tai chi, eating colors of the rainbow, and honoring your body and accepting that we are like plants, and even plants don't bloom all year, right? So there are seasons of your life that are uncomfortable, but looking at that and changing your perspective from I'm stuck to this is a ladder to my next growth, right? And so I think perspective is very important, because I find patients that are very depressed and very anxious and have a really negative outlook in life are the ones that have the diabetes, the hypertension, the heart attacks, and the ones that are just grateful, just grateful to be alive and realize that we are 1 in 13 billion. And the fact that we were even given the opportunity to be born, like that's a pretty special thing. And I think if you live from that place of gratitude, the universe supports you in that.
I heard, and I don't know the validity of this, but thankfulness, gratitude, and anxiety cannot exist at the same time. And so to really refocus on the things that you are grateful for, even like intentionally writing them down, think about it every day, it will change your perspective, especially those who do struggle with anxiety on a regular basis.
And even meditation. Like meditation is a very centering practice. It literally changes the structure of your brain. So every patient gets a long list of things to try. Usually meditation
I love it. Very cool. Well, thank you so much for coming and for just sharing all of this information. I'm sure everyone probably has like a full piece of paper in front of them with everything that they've just listened to. And we'll put some of the resources you mentioned too in the description so that you can check that out. But thank you for joining us.
Thank you so much for having me. It was great.
And thank you all for watching on And So Much More.